Okay, so the last stuff that was covered here in week 6 was some of the reproductive system stuff. So the first thing we'll talk about is gynecomastia, which is enlargement of the male breast. Pathology, usually idiopathic or due to uh, hormonal imbalances. Risk factors, recreational drug use, for example, anabolic steroids cause gynecomastia, and some pharmaceuticals such as spironolactone, cimetidine, and ketoconazole. Signs and symptoms, enlargement of the breast tissue. Labs and diagnosis, no testing unless other symptoms are present. Ultrasonography, serum hormone studies, mammography, and biopsy. Treatment, no treatment needed in most cases. Surgical intervention for cosmetic reasons may be indicated. Nursing care, be sensitive to psychosocial concerns based on developmental age. So they say based on developmental age, but I feel like no guy has breasts. Um, ambiguous genitalia. So ambiguous genitalia is variations in sex characteristics deviating from typical expressions of male or female sex organs. Pathology, gene mutation affects the sexual development of the fetus. Risk factors, maternal exposure to androgens during pregnancy. Signs and symptoms, genitalia with atypical appearance, cryptorchidism, undescended testicles, hypospadiasis, hypospadias, and clitoromegaly. Clitoromegaly. Labs and diagnostics, uh, genetic karyotyping, serum hormone evaluation, MRI, and ultrasound to view internal structures. Treatment, in most cases, no treatment is required unless the infant's ability to void is impaired. Elective gender confirmation surgery is often possible. Nursing care, do not use terms such as hermaphrodite, as these are antiquated and offensive. Cryptorchidism. Cryptorchidism means one or both testicles are absent from the scrotum, so they haven't descended. Pathology. Alterations in temperature or hormonal deficiencies lead to lack of testicular descent. Risk factors, premature birth, low birth weight, and congenital disorders. Signs and symptoms, the testicles are not present or palpable in the scrotum. Surprise, surprise. Labs and diagnostics, ultrasound and MRI to confirm testicle location and differentiate cryptorchidism from retractile testes or uh, anorchism, which is absence of the testicles. Treatments, surgery to correct testicular location, orchiopexy, and complications include infertility, testicular cancer, that's in red, and disturbed self-image. Testicular torsion. Testicular torsion is twisting of the testicle and spermatic cord. Pathology, ischemia results from the testicle twisting around the spermatic cord, potentially leading to necrosis. Risk factors, congenital abnormalities, testicular malignancy, and testicular trauma. Signs and symptoms, swelling, and abrupt onset of severe unilateral testicular pain. That one's in red. Abrupt onset of severe unilateral testicular pain. Nausea, inguinal pain. Labs and diagnostics, ultrasound. Treatment, manual detorsion, and emergency surgical intervention. That's in red. So I think this can lead to infertility pretty quickly, so it needs to be corrected immediately. Nursing care, keep patient calm, administer analgesics as so that's testicular torsion. Next, we have epididymitis. Epididymitis is inflammation of the epididymis. Pathology: inflammation caused by a bacterial infection is the most common, but it can also be caused by trauma. Risk factors: STIs, unsafe sexual practices, and poor genital or perineal hygiene. Signs and symptoms: gradual onset. That's in red. Gradual onset for epididymitis. Gradual onset of unilateral scrotal pain and swelling. So I think they're trying to differentiate that from the abrupt onset for testicular torsion. Urethral discharge, tenderness on palpation, and inguinal lymphadenopathy. Labs and diagnostics: urinalysis, urethral swab with culture, ultrasonography, and CT. Treatment: antibiotics, ice, rest, and scrotal support. Varicocele is enlargement of the veins within the scrotum. Varicocele. Pathology: impaired venous blood flow into the scrotum leads to vascular congestion and edema. Signs and symptoms: testicle swelling, subjective report that scrotum feels like a bag of worms. That's in red. Scrotum feels like a bag of worms. Bluish discoloration. Labs and diagnostics: ultrasound and thermal imaging. Treatment: analgesics, scrotal support, varicocelectomy. Varicocelectomy. Complications: the most common cause of low sperm count and decreased sperm motility, and can lead to infertility. And the last one we have is phimosis. Phimosis is excessively tight foreskin leading to difficult retraction. It's a pathological abnormality, or pathological as in Belantis, which is a dermatological condition. Risk factors: absence of circumcision and ages 2 to 4 years. Signs and symptoms: ballooning of the foreskin, difficult foreskin retraction, and the diagnosis is based on clinical examination. Treatment: no treatment necessary for physiologic phimosis. You can use topical steroids and circumcision for pathological phimosis. Family teaching: do not force retraction. That's in red. Do not force retraction. Forced retraction can result in paraphimosis, which means the retracted foreskin can't be pulled back up, which is a urologic emergency. It's kind of flow. And that's it.